Hi guys, this is Reese. I hope you all are doing well. So this video is just to present to you guys my pocket guide, which I absolutely love. And it's been really helpful in how I learn. So of course a pocket guide, just like you guys have, is just something that I can put in my pocket, and then I can use it for quick references. Everything in here, it's commonly used stuff that I see a lot in practice. So it comes in handy to just have something real quick that you can refer to. So this pocket guide has little note cards in it. I'll just show you what the note cards look like. And then, so I shrink the guidelines so that they can fit, and then the whole thing just conveniently fits in my pocket. Okay. So I have examples of what I have in here. I have the cervical cancer screening guidelines. I have the breast cancer screening guidelines. I also have just a quick reference of the signs and symptoms in diagnosing STDs. I also have like major causes of primary and secondary amenorrhea, which I see at least a couple of cases of these in clinical every day. So that comes in handy. I also have information on IUDs, just a little detailed information that I might need to share with the patient, or just for my practice, information for my practice. We see a lot of HIV cases in the practice that I'm working in, and this clinic has a grant, and it actually pays for people who want to use PrEP. So we talk about it a lot in practice, and this is just something to guide me in that practice and talking to the patient and making sure that they meet the criteria and everything. And this guideline is put out by the CDC. I also have hypertension guidelines. That's another common thing we see. A lot of people are diagnosed by us. They come in never been diagnosed before, so this is really handy. And then I love this obesity too, because I did not know this until now, but here in Houston, Texas, most people that I see, according to BMI, are considered obese. And so we have to counsel them, of course, on diet and exercise. But this too kind of helps them kind of participate in the diagnosis. So, and which helps with buy-in. So if they participated in a diagnosis, then they can see the process and they can buy in and actually do what it takes, like diet and exercise. Okay, so I have more stuff in the pocket guide. I will include a presentation with everything that I have so that you can see it all. But I did want to talk about just some helpful tips and guidelines. I've gotten quite a few clinical pearls from my preceptor. She does say some very helpful things. One of the things that she advised me to do, which I think is awesome. So let me just tell you this. So a lot of times I would get to practice, and I've read, and so I have information in my head. So, but when the problem presents itself, I've read, I have this in my head, and then I have to, go online to try to figure out where I read it at. Okay, so what she does is, and what I do now is, when I read a guideline and it's something that I know I'm going to use, I'll print it off and then I put it in a folder. So that way I have it with me and I just bring it with me to clinical. So if something comes up, I'm like, I know I got an article on that, and then I just pull it out and then I can, verify that I'm using proper practice per the guideline or the article. So that's one thing I do. Another thing is, of course, the apps that we use in clinicals. And some of the most important ones I have just all on my phone, all in the same area. And then that way I use the STD treatment guideline a lot because in our practice we have a high population who need to be treated for the STDs. I use the OB wheel a lot, and that one's just easy to just wheel out the OB patients. Hippocrates has been a lifesaver. Quick reference for guidelines and medications, of course. And then the ASCCP, that one is a quick reference for HPV and diagnosing cervical cancer and the guidelines for treatment of it. So those are just some of the apps. And then also in the presentation, I'll include some websites, some very helpful websites. Because another thing is, and I'm trying to go real fast here because I'm running out of time, but the ICD-10 codes, those are really important because you need to use the proper ones because they actually tell the story and it's how your practice gets reimbursed. So there's a really good ACOG website. And it tells you, it's specifically for women's health, and it tells you exactly, the best practices for using the ICD codes. So this concludes my Pocket Guide presentation. But I sure hope you guys have a good rest of your season, and I can't wait to look at your clinical pearls. Thank you.